I want to remove all dark spots, acne, and have clear skin with one peel. Also, I have sensitive skin, so nothing aggressive.
That's what everyone says.
I know.
Because they're like, I want you to do this, 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 and this, but I have a party in 3 days, so you can't go.
Okay. I have yet to meet a girl who has not said that they don't have sensitive skin. So my thought is, I think people think it's like we would treat them extra careful because they have sensitive skin, or they want to have sensitive skin.
Who wants to have sensitive skin?
I don't, because I don't think they really understand what sensitive skin is. So I always tell them, I say, well, what makes you think you have sensitive skin?
So I think people interpret sensitive skin in a number of ways. I think patients that are more acne prone, they think they have sensitive skin. Mm-hmm. I also think people that have rosacea think they have sensitive skin, which they do. And then there are people who are more atopic or tend to be dry, and they have sensitive skin. And then they have people who are just over drying themselves, who don't have sensitive skin at all.
And sensitized.
They're making themselves have sensitive skin because they're disrupting their barrier.
Please correct me. I say you might have a sensitized, or you might have a sensitized skin, meaning like you have overused products, or you're not used to products that do something stimulating to the skin. So they feel like an immediate like tingle,
right?
And then they're like, oh my god, my skin's sensitive. So there's that, and then I say sensitive skin is really truly like eczema,
right?
Psoriasis, like a genetic condition that never goes away.
You have an impaired barrier basically if you have sensitive skin.
I don't think I have sensitive skin. I apparently do because I have eczema and psoriasis. You, as my dermatologist, would say I have sensitive skin.
So
I like to say I don't.
Just to correct this part, the word sensitized, it really means that you put something on the skin, and then that then makes the body overreact in a way that it should not. So it really has more to do with allergies. But there are products that we kind of expect that there's a little bit of a getting used to period. Yeah. And many acids, right? You put them on the skin, they give you that little like prickly feeling. Yeah, or any of them, even lactic, salicylic, glycolic for sure. But that's not really sensitizing anything. It's just more, those are things that are, they're breaking down a barrier. Right? In some people, yes, but in some people, if you overuse it so much, you break apart all the little seals between your epidermal cells, and then you're letting out all the moisture, and then you're just letting the acid on in there, and you really don't necessarily want that much of it in there.
And that's like dermatitis. Is that how dermatitis can occur?
Yeah, of course. If you over-irritate your skin by putting too much stuff on it, then you're going to get bumps and it's going to be itchy. People, if you tend to be dry, you're going to be dry on your face and dry on your body, but actually the face tends to be a little more oily, so you're a little bit like unusual. And I would argue the fact that you can't tan here, you are dry. Like you feel when you rub it, it's like definitely a different quality. And this is where we expect in most people with eczema to have, again, like small breaks in their skin that you don't even see. And that's why it ends up staying white, because you just have inflammation, and the inflammation doesn't tan. But same thing when you look under the eyes, like if you put too much retinoid, as you have here, that dries out the skin as well, and that's why you get all those little crisscross wrinkles that, you know, usually aren't there in you.
So this is a self-induced problem.
Self-induced irritant dermatitis. And then there are people, though, also for face, and I would say you fall in this category, you have eczema or atopic dermatitis, which means you're sensitive, meaning we got to be careful with products, like limit fragrance, don't be piling a bunch of acids on at once, you know, don't try to do glycolic and retinoic acid and hyaluronic acid on the same day. We know we've done it before. But then I think you have a tendency sometimes to be acne prone as well. So then if you put something else on and that fixes the eczema, well, it may kind of upset the acne too. And there are a number of patients that have that.
We remember when we did this class, these are some of the questions that they gave. So I'm going to just jot off a few. What is one of the questions is normal reactions to Botox and fillers. What is like a normal reaction? Because anytime somebody has a slight reaction, they have sensitive skin.